Where were you in 1918? Welcome to today's episode of The
I
Mark.
don't even think I was a glimmer.
You were not a glimmer in your father or mother's eye.
No,
Welcome
they
to
weren't
this
not a
episode of
glimmer.
Total Health Live. I'm Dr. Christopher Vogelmann. As always, with me is the wonderful, the talented nutritionist to the stars, Monika Klein.
Hi, everyone. Happy new week or happy end of week. Let's put it that way.
EOW, as opposed to end of
EOW,
week.
end of week. Yes.
End of business day. Actually, it's not at the end for a lot of people. So we're just some folks are still busy working here on the Pacific, Alaskan, and Hawaiian time zones. So
Yes, we
um,
were.
yeah, so you had some stuff. I put this up as 1918 versus 2019 because I thought it was always interesting to see how pandemics operate and how different it is in 2019 and now 2021 than it was in 1918. And I think it's interesting because there was resistance to masks. There was social distancing. There were people, many, many, many millions of people hospitalized. But the one thing that was lacking in
Internet.
1918. Well, the internet was lacking, yeah, that's for sure. But also, what was lacking was a vaccine against the so-called Spanish flu. And with several vaccines available, there seems to be a lot of resistance continuing. You said something about Idaho. I saw that just now flash by my eyes.
Yeah, Idaho. Well, it's interesting. Idaho is, I can't, I apologize. I can't remember the exact term, but they are refusing care to those who they don't think will make it. As
Oh, that's
opposed to
triage for sure. Yeah.
yeah, so it's like two patients and they're in the ER and one will
Yeah.
probably have a likelihood not make it and one will make it. They'll choose the one who is making it, which I think is
That's the way life. When you have
questionable.
scarce resources, that's what you do with scarce
Okay,
resources.
I think there's an ethical question here, though. I mean,
Well, then maybe they should have gotten vaccinated, or maybe they shouldn't live in Idaho.
but you don't know the person. Okay, the person could have been vaccinated,
Yeah.
and the other person might not have been vaccinated. One is 85 years old, the other is 25 years old. The 85-year-old has been vaccinated, has a lot of comorbidities, and the other one is reckless, a reckless 25-year-old.
And are both conscious where you can take a full history. There's a lot of questions. I think when on the battlefield, and this really is a bit of a war. On the battlefield, they do this all the time. I mean, if you've got 12 soldiers who are injured, you look for the ones who are the most likely to make it. And it's not an issue of age. It's an issue simply of, okay, this person's missing two legs and has an open wound in the abdomen. This person's missing one leg and doesn't have a wound in the abdomen. Let me go with this guy first, or this woman first.
Yeah,
yeah.
I think. Yeah. Go ahead.
I would say it's a similar type of thing. So if you have limited resources, and mind you, this has gone on for decades with health insurance companies, they will decide who gets their care paid for and who does not. And pre-existing conditions and all kinds of different things come into play. Things are changing dramatically when it comes to COVID-19 and other things, where it used to be your care is going to be free, and now insurance companies are charging people, some of them since February, some of them since January, some of them since even November of last year. They're charging the full copays, the deductibles, and everything. And there are a lot of people who are hospitalized, they've gotten care, and they're the ones who are coming up with $10,000 bills now that they did not expect.
So what you just said, and you explained that very well. However, I totally disagree with just because that's the way it's been, and that's what happens in a battlefield, and that's what happens here, and that's what I still don't think it's right. And
well, you could start a group that would be, an advocacy group for changing it, I guess.
Yeah,
I don't have the time for that.
Advocacy groups, but I'm just, my opinion is I don't think it's a right thing, and I think a lot of people feel the same.
So here's the thing: what would be the right thing with a 25-year-old and 85-year-old? One of them gets chosen. Who do you choose? You have to make a choice.
It's like Sophie's choice. This is Sophie's choice.
This is Sophie's. No, this is Monica's choice.
I can't really tell you, and if there should be no choice. There should be no choice. That was the whole point of Sophie's choice. There should be no choice. It's cruel.
I thought some of us were pro-choice.
Yeah, I mean, always pro-choice. My choice is both.
Your choice is both, but you only have one ventilator. So that's the thing. I think
Well,
that's the
yeah.
most difficult thing now. It's when ICU beds are all full. Now you can take them to other states, and the question is, will the 25-year-old or the 85-year-old, maybe the 25-year-old is reckless and has comorbidities. I mean, there's a lot of stuff
Well,
that you need to do,
of course,
especially.
I've seen,
Yeah.
really sick young people and really great
Yep.
shape people who are older. Of course, those are all very specific and personal, but
Yeah.
just sort of randomly, well, I mean, I think a lot of people are sort of not happy with that. I mean, not to be happy. It's not a happy
Well, the
thing.
question is, what is the solution? Is what I would get to.
Well,
That's
yeah,
all.
and I like to get into solution. There's got to
Yeah.
be a solution,
Such
and
as.
well, I don't know yet. I mean, it's
Well,
just
okay.
new. I mean, certainly we have to figure this out. I mean, I'd be heading a huge task force if I knew the answer, but certainly we'd have to think and consider and look at all the possibilities. But yeah, I mean, I think, I don't know if Idaho has been criticized for this, but it's definitely not a lot of people.
There are hospitals in Mississippi that are doing the same thing right now. So that you have
Well,
to
no,
state by state.
it might be they're sort of setting a trend, unfortunately, because Idaho is not normally known as a trend-setting state. But
Not the trend you want to set.
yeah, exactly. I mean, anyway, I just want to bring it to the light, and I you know I mean, this has been a conversation that's been had for a long time, but now it's like really okay. We have a pandemic, so
Well,
now
even
it's
for, I would
really.
say, yeah, I'd say you're right. Even for decades, because does the 70-year-old smoker with good health insurance get the heart transplant? Yes or no? And that's even not considering whether they've had reckless behavior or not. I mean, do you discriminate based upon age? Do you discriminate based upon comorbidities?
Or
And it's
reckless behavior.
a reckless behavior. But here's the thing: um, we as a society have a compact with health insurance, and particularly with public health options like Medicaid and others, to take care of everyone in society so that all of society is better. Now, the question is, because you have a mixture of private and public institutions, that becomes really difficult because everybody's tugging at the money as well as staffing. And staffing is a big issue right now because there's so many nurses. There's an ICU nurse shortage nationwide.
Well,
And
there's always been a nursing shortage. Always, as long as I can remember, there's always been a nursing shortage. And I can only speak for North America. It's a tough job. It's a hard job. I respect that job and anyone who's working in the hospitals. But yeah, this has always been a concern, and there should be. I guess there should be more enticement to get people. I mean, not everyone can be a nurse, right? So, but
no,
perhaps there should be more I don't know, incentives. I'm not sure of the answers, but I mean, in my little world, I'm facing this on a daily basis too, these kinds of shortages.
well, it's interesting because different hospital systems right now, some of them are paying $10,000 as incentives to bring new nurses into hospitals, and the nurses who are currently on staff are pretty pissed off that the hospital might only give them $1,000, but somebody new coming from out of state gets 10 grand.
Well, this is
And the
what.
one
Yeah, sorry,
and
go ahead.
so payroll is a huge issue right now in hospitals. And when you've got a lot of bean counters who are essentially accountants acting as hospital administrators, they're going to cut corners wherever they can. And I would tell you right now that from all the nurses whom I know here and nurse practitioners, there's a lot of chaos in almost every hospital in the country right now.
Yeah, I mean, I know in our local hospital, a lot of the nurses are going to other hospitals, nearby hospitals, because they're getting better pay. But this is something that we brought up the last 2 weeks is this, don't give hiring bonuses, give retention
Right.
bonuses,
I
because
would agree.
you want to keep the people you have because they're skilled. They're part of the family, so to speak, in that work environment. So yeah, I mean, it's a whole shift that's not really catching on, or maybe it is. I don't really know, but it's a slow process.
Oh, they're just full of shift right now.
So yeah, I mean, as far as the middleman system here in the U.S., it gets so bogged down, and that doesn't happen in other countries. Most notably the one I know
Our neighbor to the north.
most about is Canada. That doesn't, I mean, it's not perfect. It's not a perfect system, but it's definitely a little more, everyone gets care, period.
When you think about it, one of the things that always struck me very interesting is the example people give of tuberculosis. And so if you have a very highly contagious strain of tuberculosis and you have someone, for example, let's say who is homeless and a drug addict, or recovering, alcoholic or recovering drug addict, if you deny that person care for whatever reason, that person could likely infect a huge number of people and have a very negative effect on a wide swath of socioeconomic groups throughout society. And some people just don't get that picture, which is getting somebody to stay on a regimen to get rid of that tuberculosis, which has been a big problem for the last 3-4 decades. Particularly the last decade before this whole COVID pandemic. That's a big deal. And because then you see the ripple effects. Well, people aren't seeing the ripple effects necessarily in most cases, or at least they're sort of denying that there is such a thing as a super spreader event, or the viral, excessive viral load being spread by people unknowingly from one situation to another. But I guess we're sort of in control of some of it in California right now. It seems to be, we're like one of the best states now in terms of the reduced number of hospitalizations.
Yeah, and just, I know we could spend a lot of time on this philosophical question, because it all boils down to who has the right to decide who stays and who doesn't, who has right to live and not to live. So that is like ethical, philosophical,
It's a
and
big
it's
one.
a big topic. And I don't think we're ready. We only have a small, short period of time, 50 minutes. So
I'm keeping the 25-year-old, and Grandma's going to go. She's had a good life.
oh no. I mean, if it were your loved one, it would be a different story.
No, if I had two of them, I probably would go for the younger one. I've got my grandma versus my stepson. I'm going to go for my stepson. I mean, and that's in a situation where I'm forced to make a choice because there's one bed and one ventilator. And so we could debate all day long, and both of them could die.
Well, I mean, yes, of course, time is of the essence, but I mean, it hits home to my life, but quite dramatically. So I want to keep my husband out of the hospital at this point.
Well, I hope he's not 85 years old, because
No,
wrap
but
the cradle on that one. So.
Well, again, we're not talking about age. We're also talking about comorbidities,
Yeah.
and we're talking about state of health essentially. So, and I do have a 100-year-old mother too, who.
But she's covered in Canada, which is great.
She is covered in Canada.
Yeah, so she's
Canada.
Covered Canada. Hey, speaking of coverage, what's the coverage of Delta these days? I see that it's dipped a little bit, but I don't know if that's permanent or not, because the weather's changing and people are going to be indoors and spreading through the holidays.
Well, I want to tell you some interesting things that John Campbell.
John Campbell. See, I'm the one who usually makes that mistake, not you.
I know. I've been a Joseph Campbell follower,
I think that's just a myth. That's totally just a myth.
Yeah, he's a myth buster, right? Yeah, I used to call myself a Campbellarian. I guess I am now again with John Campbell.
I ate a lot of Campbell's soup as a kid. Does that count?
Sure. Me too.
Good.
We're all Campbellarians.
Campbellarians.
So interesting thing, they're doing kits in India. They're giving out these kits in India, different areas, and one is a very populated area. I think it's 205 million in this particular area. And these kits have vitamin D, vitamin C, zinc, a antibiotic, ivermectin, masks, an N95 mask, and just regular masks. And it's just, I don't want to, multivitamin tablets, D3, ivermectin, doxycycline, that's the antibiotic, 3-ply face masks. And they're showing like an amazing, I don't want to use the word amazing. They're showing like it's really, alcohol wipes and gloves. They're showing quite a decrease in cases. And it's really quite correlated to these kits that they're handing out. This is the
It's
government.
the do it. Yeah, I mean, there's a certain benefit to the do it yourself approach of keeping yourself as healthy as possible. Yeah, the
The
ivermectin thing
cases
is,
are going down. The
yeah,
cases are
but I
going
mean,
down.
you can't in that situation. There's so many variables. It's very hard to hone in on which is the most important. It could turn out to be the alcohol wipes or the masks and alcohol for what you know. But giving out a bunch of antibiotics, the only thing I can think of is that would help with secondary
Yeah, I
infections,
mean, that's exactly why they're giving it.
or with people who are already sick so that they can get better from their pneumonia or whatever infection that they may have. Nobody really knows what they may have unless they get to a doctor. But there's tremendous issues in India. Particularly, you've got how many billion people? Is it
Yeah,
1.2 billion? 1 point. It's the
yeah.
largest democracy in the world,
They're
and
isolating
yeah.
the particular
Well, and I
district.
think isolation is actually very important. But
That's something that they did a lot of.
yeah, and I think it's something that grates against the individualism of many Americans. But at the same time, it's just a question. Is your individual liberty the most important thing, or is the well-being of everyone else, including you, the most important thing? So it's a collective. Are you going for the community or the individual when you're
Well,
looking at these things? So.
yeah, and I think that's the success of some of the countries that we've looked at. That they're, but there are like countries in Africa, or specifically Tanzania, where they just denied the whole thing right from the get-go. And so, of course, we don't have any statistics on reporting. And my nephew lived there for, as it was beginning. He just left. He was there teaching in a international school, so he's left already. But they totally denied the existence of this, and we don't know the caseload. We don't know.
Yeah, if they don't share information, that's the one problem with many nations. Actually, some states, we've even saw that during the pandemic here in the
Yeah.
U.S., where states wouldn't even release the information about the number of hospitalizations, or they were discouraged from certain government agencies from even mentioning how many people were in hospitals. So.
Yeah. So with regards to the decrease in Delta, well, we're hearing less of it here anyway in California, but
yeah, across the U.S., you're still getting. It was as many as 3,000 something deaths a day. So we're up well above. I guess we're knocking on the door of 700,000 within the next few weeks or so. A total deaths attributed to COVID-19. But
yeah.
that's a lot of folks. I mean, but
I think it was like, I don't know what it was at the end of 2020, but I don't think it's gone up as incrementally as it did last year.
It depends on which surge. I mean, we're in fact, when you look at it, we were almost back to the January rates of hospitalizations and deaths.
But what I'm saying is the total at the end of the total deaths at the end of 2020 is greater than it. I mean, we're not at the end of this year yet, but it's greater that 2020 than it is this year. I'm assuming. I might be wrong. Please tell me.
We were close. Well, we were close to 5. So we were close to, was it 500,000 or something like that? So now we're adding like another 200,000. Yeah. So maybe the rate of deaths has slowed down, but still, if we hit 300,000 plus the 500,000, you're starting to knock on the door of 1 million people.
I mean, it's terrible. It's all terrible.
And we're talking numbers like these are little beads.
I know,
or marbles. I know. But these are human beings with families.
Human beings. Yes.
These are people. Some have had breakthrough infections who've been vaccinated. Some have comorbidities. Some people denied the vaccine. The thing was interesting to me. I think I sent this to you. I'm just going to highlight it for just a second. This one just fascinated me, which was this article. I follow this fellow.
Oh, I saw that.
I follow this fellow on Twitter, and and it was the vigilante treatments where people are actually trying to pull folks out of ICUs to leave, and so they could get these so-called life-saving treatments, but they're really going to Dr. YouTube as their primary care provider, and it's very interesting. It gets to be very conspiracy oriented, which is a little crazy. But there was a Harvard doctor who was talking about it, how discouraged he was that, and his approach had to be very interesting. He would actually kneel down in front of the patient and talk to them, saying, I'm your doctor. I'm somebody who's here to help you. And this is, there's the fellow. It was, let me see
Anthony
if I can find him. Well, Fauci
Anthony.
was not the one, but it was,
We do know who Fauci is.
who's that guy? What's that? But it was down. Oh, here's the one. She says, so I kneel down, I look into her eyes, I hold her hand and tell her, I'm hearing you. I'm not going to leave. I'm not going to abandon you. But there's some people you just can't get on the other side of it. He says, when people get this sick, they're very likely going to die. And when almost all the pregnant moms who are in the ICU with COVID in this situation, when they wind up losing their babies. And so we have 2 people dying without treatments for COVID. So it's just a really tragic situation. I've been very much involved in so-called alternative medicine and just, I guess, basically what healthy eating and living and stress reduction is really
That's
not
what
an
we're all
alternative.
about here at Total Health Live.
It's not an alternative, really. And so you do want to keep yourself strong. I'm happy to hear that in India they get themselves some good supplements as well as those medications, because you want to boost your immune system.
Yeah.
You often talk about the D3 levels and vitamin C and a number of other things.
I think everyone should get a kit. I think those kits.
We should all get kits.
Let's get kits here for kits.
No,
So
we're here for kits.
Here for kits. So it's interesting that you mentioned that, because last week we talked about this ivermectin, that the dosages weren't being accurate, so they stopped prescribe. Something happened there. But I just listened to an interview with a physician there, and basically there's sort of like an illegal drug market getting the ivermectin into the country, and of course the dosing is based on what they're seeing on social media, so they're taking it into their own hands on how to dose, and that was the problem, of course. So
and doses are interesting. The dosage too, you talk about, because those studies that they've done recently on inoculating kids from 5 to 11, they only use 10 of the microliters versus 30, which is the adult dosage. I think it's interesting, and
they have to.
Yeah, but what's interesting too is that they've even had some individuals above the age 12 and above, they found that they're also effective at a lower dose, which I find very interesting.
Well, it's interesting. I mean, dosing is an interesting thing when you're working with different medications, and titrating and trying to figure out the exact dosage for different things. Like, for example, I'm trying to work on something with gabapentin right now, and that requires a lot of attention. So you have to work with your physician and perhaps your pharmacist as well to figure out whatever you're trying to, whatever medication you're trying to figure out.
I would say to those who are super skeptical, the doctors and nurses are not trying to kill you.
Yeah, and you have to like, this is the thing. I hear this all the time from someone. Well, did they tell you to do it this way? Did they put him on this? And I understand a lot of people for medicine and the medical world is sort of like, it's complex and hard to understand. But I would encourage people to work in partnership with your team, with your doctors. They are not, you're working together. You're providing information. He's providing, or he or she is providing information. You're working and figuring it out together. What the best thing is, because they don't know. They're not with you 24/7. They don't see what's going on, with you after you take a certain medication. So you have to be in communication with them, and don't worry if it's better to be in communication than end up in the ER, especially now. So
you do not want to go to there.
No, you do not want to go to there at all.
Hey, you had something about shortage of parts. Are you talking organs, or are you talking about medical supplies?
Well, possibly both, but I'm talking about not only medical supplies. I mean, yes, I was talking to a medical supply company. One week they don't have wheelchairs. The next week they don't have walkers. They didn't have a trapeze. These trapeze. Wait,
I was going to say, are you learning to do acrobatics?
I am in my spare time.
From dancing to trapeze artist, the Monika Klein story.
when you're at home, you've got to figure out something to do, right?
Something to do rather than twiddling your thumbs.
So anyway, these trapezes are attached to hospital beds, and they help the patient sit up or transfer or move to the side of the bed, or they also are good for exercising. Well, it took 2 months to get that. So this is really, interesting. And also the car market is dealing with some sort of thing with the something.
Some sort of thing with something. I love the specificity today.
Okay, so the prices of cars, are through the roof right now, just like real estate. And but
that's why you get a convertible, because it doesn't have a roof.
I think there's microchips or something in the cars.
Yeah, every car has computers. This is an interesting thing, because cars do have computers, and cars rely upon certain types of chips that are also being used in large server farms, which run the mining for Bitcoin and other types of cryptocurrency. And so there's it's interesting to see how the supply chain has been disrupted, in part by different businesses that are thriving. And as a result, there's a ripple effect all throughout society and business.
And you wonder if it's a little bit planned that way,
I mean, it depends. I know that friends of mine were having a real hard time getting video cards for computers, and they would make their own computers, and it was just almost impossible to get one at a reasonable price nowadays. So.
Well, I know, like about 10 years ago, there was the conversation about silver, silver being like really, even because it's utilitarian, and it could be even more valuable than gold because of these very things, using it in computers and using them in microchips. And so I don't hear that conversation very much anymore. If that's the reason, if there's a shortage of silver, who knows? But I think it's more in the manufacturing.
Gold is actually big in the manufacturing of computers also, so it's interesting.
Really? Yeah. So I didn't realize that, but I know silver is a more utilitarian mineral or metal. So interesting.
Well, from microchips, we can go to chocolate chips,
or potato chips.
But I was thinking chocolate chips because we have Q&A, and Lily is from Hershey, Pennsylvania.
Oh, so hence, there you go.
That's my chocolate chip, microchip to chocolate chip transition.
There you go. You're ahead of me here.
I am slightly ahead of you here. Well, we do.
You have the questions in front of you.
I've got something in front of me now. She says that even though I live here, I'm really not a big fan of chocolate. Oh, poor Lily. But I do think of it that it could be a good source of things that I need to be healthy. What am I missing? Well, aside from some antioxidants, what do you think she might be missing?
Antioxidants, polyphenols, or magnesium.
Magnesium.
The source of magnesium chocolate is. That's why a lot of people, a lot of women who are having their periods, they crave chocolate, and it's usually the magnesium that they're lacking. And if you take magnesium,
muscle relaxer,
muscle relaxant, you might not get the cramping that is so connected with the menstrual cramps.
You don't want a lot more. Get rid of the cramping.
Get rid of the cramping, as John Campbell, who doesn't have a Scottish accent. Yeah, so
I think so. But is there anything else? I mean, because she's just specifically talking about chocolate. I guess she's wondering if if she's missing anything. I mean, if you're taking magnesium and other things, I don't think you have to be a chocolate lover.
Do not have to. Just because you're from Hershey, Pennsylvania, does not mean you have to. I wonder if it's wafting. I've never been there. Is it wafting in the air? Is the smell of chocolate?
You do? Yeah. I mean, I have not been there. I've been very close to it, like within miles or so, driving with the windows down, and you can smell chocolate in the air.
Yeah.
It depends. It's just like when I lived in St. Louis, I lived downtown in the Central West End, and you could, if the wind caught you right, you get the mash from Anheuser-Busch coming across as you get out the door in the morning, and it was the most awful smell in the world. All those fermented hops and everything coming. It was like burned, almost like burned hops.
Really interesting.
The Folger company in Kansas City, I had that was burnt smell of coffee running past me one time when I was teaching a seminar.
Yeah, that's tough. Here in Oxnard, just up the road here, there's garlic. They grow lots of farming here, and they grow
Hmm.
garlic. And man, that just it's
Pungent.
very aromatic.
Aromatic.
Aromatic, yeah.
Oh, you wouldn't spray eau de garlic on you when you're going out to an event,
No,
unless
but
it
it's
was a vampire ball. That might work.
yeah, and it's so good for your immune system, garlic. So, but yeah, and then you go down the road a little bit further, and then you smell the sewage treatment centers and things like. I don't know.
Mm.
It's like, you know, I was
Okay,
sure
Sophie's choice: garlic versus sewage.
garlic wins. There's a
Garlic
garlic
wins. Okay.
festival here. There's garlic ice cream here in Gilroy.
Chocolate versus garlic. Which wins?
It depends. I mean, I love
Okay.
both.
If you're in a savory kind of mood, that'd be the garlic.
Yeah, I love both. I love both. Well, here's the thing, back to the chocolate,
Yeah,
there's a lot of sugar in chocolate, so maybe it's a
that's the
good
problem.
thing that you don't like the chocolate, although, the bitter
Bittersweet. The
chocolate,
baking chocolate is
baking
nasty. But
chocolate, yeah, that's like wax.
as a kid though, I would eat a little piece of baking chocolate, and I wouldn't touch chocolate again for a couple of months because it was so horrible.
Yeah, horrible. It's like wax. But the darker the better.
Hmm.
But I
I like the
personally
90% cacao, and nobody else in my family does. So
Personally, I cannot. I mean, I know it's so great, and we've been talking about it and promoting it in this world of healthy nutrition for a long time. But
mhm.
personally, I'm a milk chocolate person. I just am. So I'd rather have less, less of it. But when I have it, I'll go with milk chocolate. I just find it too bitter. I find dark chocolate a bit too bitter for me.
I find bitter is better for me. And I think it's funny because I used to be a milk chocolate fan. I switched over to the dark side.
Yeah, the dark side. Well, the good thing about the dark chocolate is that you won't eat as much because
True.
it does, you only need a little bit.
It satiates you very nicely. So Lily, I think we've beaten that little
Yeah, there's
M&M
your
to death
chocolate.
here.
Yeah. You're no chocoholic, so
Yeah, you don't have to be a chocoholic. I understand how people like white chocolate though. That's just way
that's
beyond
not
my.
even chocolate. That's not
It's just
chocolate.
it's horrific. It's just
Yeah,
not good.
it's not
White
really
chocolate is like AM radio. So anyway,
Yes,
so
indeed.
we're moving from Pennsylvania to Nevada or Nevada. If you say Nevada to somebody who's from Vegas or someplace else, they look at you. You're not from here. They say Nevada. So
It's very
David, you're from Henderson. I've been to Henderson many, many times for seminars. The lake, what was it? It's Lake Las Vegas, is there? Right in Henderson. It's very nice.
Yeah, I've been there too.
Um,
It's the
David,
conference capital, isn't
it
it?
is a conference capital. It became the Hilton, but it was some other name before then. So, um, David from Henderson is saying, he says,
Okay.
I suffer from poor sleep.
Mm.
Do you recommend anything like melatonin or other natural sleep aids? I don't really want to take medications.
Good question. Yes, melatonin can help. It doesn't help everyone. And here again, you want to manage your dosing of it, but yes, I would try it and see if it's effective for you. There are other things that you could try. Magnesium is helpful. Calcium is also helpful. So you might want to take a calcium magnesium supplement at bedtime. Valerian,
Passiflora was one I liked a lot.
passion flower.
Passion flower, passiflora, yeah.
Yeah, that's the Greek or the Latin.
I think it's Latin.
Yeah. So yes, it would be they're all in Latin terms. So there's a lot of herbs that you can take that are helpful. I've been talking about this product for a long time, and it's called Stress Arrest, and I love it. And I don't have any right here, but it's also helpful.
If you get stress arrest, do you have to post bail?
Yes, you
Will
do.
they let you out? And do you get on
Last
parole?
time I moved was not a good thing. I dropped a whole bouquet of flowers.
I remember that. I do remember
Yeah.
that.
Yeah.
Oh,
So
man.
yeah, there are different. There's GABA. GABA is helpful. It's a relaxing, calming neurotransmitter.
There's a lot of good
too.
teas. There's a lot of good teas, herbal
Good
teas that
teas,
you can
yeah.
take before bedtime. But if you drink
Yeah.
too many of them or too great a quantity, you may go from T to P in the middle of the night.
Yeah, and that would be counterproductive, right?
Yes, it would be counterproductive.
Would be.
But there are options, David, and I think
Uh-huh.
it's you need to do some research. I would also talk to your healthcare provider, your physician, nurse practitioner, whoever you see regularly, and they may have some recommendations for you. Because after all, everything has to be attuned to you as an individual. There's not one size fits all when it comes to these recommendations.
Yes. So there are a lot, and
Yeah,
so I would do your research, and I think the question
doesn't want
initially
to take meds. Yeah,
was melatonin. So yeah, try things out.
yeah. I
And
mean,
just listen.
melatonin is good, but I think and yeah, you're right, Monica. That it doesn't work for everyone. So
Yeah, I for me it doesn't work, but
yeah.
for a lot of people it does.
Maybe it's in the Germanic genes because it doesn't do much for me either.
Maybe it's that Germans don't do good with
And they just don't.
melatonin.
We're not as mellow as the rest of the world. Okay, so hopefully that gives you the info that you need. Let's go on to our next questioner from Iowa, from Des Moines. This is Cecilia from Des Moines.
I was going to say, speaking of Idaho, but no, we're not.
No, they're different. Iowa. We had this the other day. It was like a previous episode. It was Idaho versus Iowa.
That's right. That's right.
It's EIEIO.
That's right.
You know, I mean, this is how I remember but it's pretty funny though, because I mentioned this to a group Zoom call the other day. I said, in the chat, it was like, oh, so Ida was my maternal grandmother's name. And I said, Ida was not a hoe, which is how I remember it.
Well, Idaho. Whatever works, right?
It works for me.
Too.
Anyway, so Cecilia, the only places I've been to Iowa was Davenport, Iowa, which is the fountainhead of the chiropractic profession.
Fountainhead.
Yeah, we call it the fountainhead because it was the first chiropractic adjustment was in Iowa, in Davenport. Actually, the anniversary of chiropractic was the September 18th.
It just reminds me of Ayn Rand's Fountainhead, which I just found one of her books on Netflix as a feature series. But that's a segue.
Don't get Randy here. So we're talking to Cecilia. I've really gotten off track with my eating. It doesn't surprise me, Cecilia. A lot of us have. I love eating soups and veggies and some healthy proteins, but because I'm exhausted from so much going on in my life, I've been snacking a lot too. Even after 8 p.m., which is something I never used to do. I need your help.
Yes, you do.
Yes, you do, Cecilia. Cecilia, you're breaking
my heart. You're breaking your diet results.
Daily.
Welly.
You're breaking your health habits daily.
Stop it.
Stop it now.
Stop it now. So you didn't used to do this, and now you're doing it.
She has a new bad habit.
Yes, it's a new bad habit. It's new, and that's good. That's the good part, because it's not quite integrated and it's not chronic. It's not a chronic new bad habit. So you can shift. Look at what's happening at that time in your day. What are you doing? What are the triggers in your environment that are saying, go to the fridge, go to the cupboard? What's happening? What has shifted from now to before?
Because it sounds like you're stress eating, actually.
Yeah,
you're exhausted,
exactly.
But yeah.
It's sometimes you're caught in that scenario because you're doing too much and you're not really taking regular breaks throughout the day. And again, if you are doing too much, you have to look at your life. Sometimes you can't make the changes. Unfortunately, sometimes it's foisted upon you, all these responsibilities and sometimes trauma. But try to start, identifying what it is. And if you are feeling like you need to eat something to keep yourself going for whatever reason, try just to go to sleep. If you're that exhausted, just go to sleep. Or use some tea, as Christopher was saying, maybe not for sleep inducement, but to calm you down. Because sometimes when you're so revved up all day and then you're exhausted, you want to continue being revved up. So you grab these foods. I'm not sure if you're grabbing. Did you say snack foods or
She just says snacks in sort of its generic
snacks? Yeah.
form.
Well,
So it
I
could be
mean,
snacking on carrots, and that
you
wouldn't be
could
too
be
bad.
snacking on carrots, but it sounds like it might be snack food. The
Like
sugary, the
Hostess
salty,
Ho Hos or cupcakes or
Idaho
potato
ho.
chips. Idaho. I'm telling you, Ida was not a hoe.
She wasn't. I
She
believe
was
you.
not. She's a very good, very nice lady.
So yes, of course. So yeah, it's. I'm just assuming that they're snack foods, so you're sugary, salty,
Yeah.
crunchy, all of those things. So unless you have to stay awake for some reason, go to sleep, get some rest. Really, rest is such good medicine.
Mhm.
And if you're struggling with it, maybe you should look at just as our Henderson gentleman was
David from
asking.
Henderson.
David,
Yes.
yes. If you're having trouble sleeping at that time,
Melatonin, magnesium.
I mean, you could try some of those things. But
I don't think
um,
chocolate would work because if chocolate before bed, you've got caffeine in there too. So
caffeine and sugar,
and sugar, yeah. So
and
that may
sugar,
not do it.
yeah. So yeah, just you don't have to stay awake till midnight or
Well, I hear
11.
you. And I think it's what you often say, Monica, which is vitamin S for sleep.
Yeah,
You know,
my favorite
so
vitamin. My favorite
your
vitamin.
favorite
Well,
vitamin.
actually, I think my favorite vitamin is vitamin L, vitamin love.
Vitamin L is the love
Vitamin.
vitamin.
And then vitamin S is probably right next
Vitamin
to
what?
S.
F for
Sleep as in S.
oh, S. I thought you said F as in fun.
Yes. Vitamin fun is after sleep or before
Vitamin
sleep.
fun. You can have vitamin fun when you get stuff done.
Yeah.
So I think, but
So
yeah,
give me vitamin.
your point that to Cecilia that it's a relatively new habit. That means it's easy for you to break this habit. So
Yeah.
try water too. Just drinking water when you're
Water.
feeling a little stressed or hungry, you may find that you're actually dehydrated because you're running around so in such a crazy manner. And if you're running around too much, the dehydration can sometimes mask itself as hunger, and you may not need it.
And yeah, and it doesn't sound like you're actually hungry at that time. It just sounds like you're stressed out and exhausted and just
And
trying to
eating is
figure
something to do. Eating is something to do for you.
that could be more boredom, and I'm not sure
Uh,
if it's boredom that you're experiencing, but I mean, it could be, but yeah,
well, I was going to say, Cecilia, if you want to clarify things or you get in touch with Monica, you can reach her at monica@coachingforhealth.com or on this page because we're
mhm.
broadcasting to 8 different locations. And you can even just drop us a little message in here and give us a couple more details without being too revealing, except we do know that you're in Iowa.
Iowa.
Iowa. Um,
Well,
oh, are we ready to move on from Cecilia?
Cecilia, see you later, and good luck with it. With that,
Cecilia later.
that's right.
All right. So, from the great state of New York, my home state, Veronica from Sag Harbor. Actually,
Oh,
there we
I've
go.
been to
Sag
Sag
Harbor.
Harbor too. It's lovely.
Yes, it's lovely. So, oh boy, I paid for an expensive detox program I was supposed to start several times this year, but due to family emergencies, I've been unable to get started. Do you have any suggestions of how to just get going? I know it could help me right now. So I guess she needs to get started. She's been sitting on her detox.
Sitting on the detox, sitting on the dock of the bay in Sag
You
Harbor.
may wind up sitting on the throne if you do the detox program right. So
Yeah. Well, that does happen. It sounds like you paid for this and it was expensive, and so there's probably people that are part of it. Someone is running it, and they may have a team. I would definitely contact them and ask them how you can handle this. What small steps? Sometimes it's like, I've certainly done a lot of detoxes in my life and my career, on myself, and put people through it. So sometimes it can be daunting because it's a big project, and you may not have the bandwidth to like totally focus on yourself, because of some of these other things that you're dealing with. So if you can do maybe 20% of it or 30% of it instead of the whole 100%, maybe that would be easier for you to ease into this. Even if you do a percentage of it, it's still going to give you some result, probably more if you're not, you're not going to get any benefit if you're not doing any of it. So yeah, talk to the people who are running the program and ask them for some suggestions. I know I did this great detox last year, and it was I was cooking all the time. So one of the suggestions
this was your passion for pumpkins?
This is my pumpkin passions, and I bought my first pumpkin last week, so it's sitting in the
Here we
waiting
go.
room.
Here we go again.
I mean, it's just been so hot, and so to cook pumpkins right now, it's like I don't want soup, but yeah, it's waiting for me. And I mean, there's so many root vegetables right now. There's pumpkins. I got this huge
turnips,
chewy. We're just going to call
big
them
big chewy. Big chewy,
I
big
got
chewy
it
too.
bigger, even bigger than Chewy was.
Big Chewy Junior.
Big Chewy is our pet name for a summer. No, what kind of
was it? It was a
butternut
squash.
Butternut squash.
Not an acorn squash, because that side of the tracks we don't deal with them.
No, we don't. We will though, because I also have a kombucha squash that I bought as well. But the stores are full of. I'm so excited. They're just full of all these squashes and these root vegetables right now. So because it's the season, it's the
Tis the season. Fa la 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 la.
Fa la 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 la. Fa la 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 la.
Ha la 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 la.
It's fall la 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 la.
Fall la 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 la. But the other thing is, Veronica, I mean, most of these programs, I'm sure if you reach out to these folks, they often will do a little bit of hand-holding and some guidance and some coaching along with it. I don't know that maybe you fell off the wagon as far as doing this, but if you reach out to them, they might be able to help you get restarted.
Yeah,
with a little bit of guidance or so. Anybody who's involved in helping people with detox programs and complementary medicine, integrative medicine, other things, they're in it for the right reasons. And if you reach out to them, I'm sure they can help you get going again.
Yeah, and they are supervised programs, so they want to know. People want to know.
It's just not a package of powder and supplements. So.
Yeah. So hope that helps. And, hopefully you get the fall la 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 in Sag Harbor.
Hey, speaking of fall, la 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 la, we're at the 47-minute mark. Should we take another one, or should we?
How many questions do we have left?
We have 2 left. And I don't know if we
save them for next week.
I think so. I really do.
Yes, because you've got to get on with your Friday.
You got to get on with your Friday. And Alejandro and Annie, both the 2 A's, we'll save your A's for next week.
So yeah, we are happy you sent the questions. Please stay tuned because we'll answer your questions, and hopefully it's not an emergency.
and yeah, exactly. And well, no, it didn't look like No, I don't think it's an emergency. No.
If it is, please call 911.
They're chronic. They have some chronic issues that are going on right here. So with that in mind, please keep sending your questions in, because we always find them to be very interesting, very useful. And hopefully we are providing enough value for you as you tune in each and every week. And we know that most of you are watching on the replay. So please use hashtag replay when you are watching, whether you're watching 8 different locations, YouTube, Twitter, multiple Facebook pages. Let us know. And if you have any topics you'd like us to cover also, we are available to you every Friday at 1 p.m. Pacific, 4 p.m. Eastern, and all the time zones in between. So anything else?
Wonderful. Great questions. Great to be with you today. And well, I guess we'll see you next week. October. Is it October next week? I think it is.
Yes, because we don't have 31 days in September.
We do not. We're going to be heading for Rocktober, Halloween month.
Rocktober, baby. Where do those Halloween candy sugar questions come in? I always love the ones who are I keep dipping into my child's Halloween candy. How can you help me? So we'll get to those later.
We will.
All right.
We'll see you next week. Month to those.
Exactly. Plenty of sugar. It's our sugar month. Bye.